Hello everyone. In this section, we are going to cover endocrine assessment part 2, that is about physical examination. I am Brindaronika, working as a tutor in Tribhulam College of Nursing. Next, we'll move into the physical examination. Before that, we'll see what are all the equipments needed for that. We need thermometer, gloves, pen touch, a small cup of water for thyroid exam, ophthalmoscope, stethoscope, cotton wisp, safety pin, test tubes with hot and cold water, tuning fork. We have to need it. Okay, first we'll see what we have to see means vital signs and BMI. It is a very important parameters. If you are seeing in hypothyroidism means temperature it will be decreased. In hyperthyroidism it is opposite, increased. And bounding pulse present in hyperthyroidism. And in thyrotoxicosis you may find Korokov sounds going all the way down to 0 when measuring blood pressure, meaning you cannot determine the diastolic accurately. You will also see a widened pulse pressure with high systolic. Both the signs of hyperdynamic cardiovascular state in thyrotoxicosis. BMI. Mainly you can see obesity in the Cushing syndrome and low BMI in hyperthyroidism. Next, skin. In the skin you can able to see the acanthosis, that is we have already seen, and we can able to see the generalized hyperpigmentation and mostly in sun exposed areas, in additions disease, and also in additions the pituitary overproduces ACTH trying to stimulate for failing adrenal glands, and ACTH also stimulate melanocytes which cause that widespread darkening. And rough, dry, flaky skin like sandpaper is a hypothyroidism. At the time, fine, warm, smooth, sweaty skin is a hyperthyroidism. Next one is a hair loss. So alopecia is very common in hormonal disorders. Hirsutism is common in females. Those with excessive androgen levels, it will be present in Cushing syndrome, PCOS and adrenal tumors. And in hypothyroidism you can able to see the dull coarse dry hair. In hyperthyroidism you can able to see the fine silky hair. Next one is a nail. So you can able to notify the spoon shaped nails, and in thyrotoxicosis you can able to see the paranoia, and thick brittle nails that grow slowly are hypothyroidism. Next, scalp and face. A thick and enlarged scalp is seen in acromegaly from excess growth hormone. For the face, moon shaped with reddened cheeks and increased facial hair is a Cushing syndrome. And puffy swollen dull face is you can able to see it in the myxedema. And also look specifically at the eyebrows. So thinning or loss of these eyebrows, it is a very classical sign of hypothyroidism. Next, eyes. In the eyes you can able to see the exophthalmos in Graves' disease, and to check for lid lag, ask the patient to follow your finger downward and observe the upper eyelid. So if lags begin and you can see the white of the sclera above the iris, that is lid lag. And ptosis is seen in hypothyroidism or pituitary tumor. Diplopia you can able to see it in the hyperthyroidism. On fundoscopic examination for diabetic patient, you are looking for 4 specific things. First one is a cotton wool patches or soft exudates, which are microinfarcts of the retina. And next, hard exudates, which are yellowish lipid deposit. And next, deep dot shaped hemorrhage with a retinal layer. And microaneurysms, which are the earliest sign of diabetic retinopathy. If you find any of this, the patient needs urgent ophthalmology refer. Diabetic retinopathy is a leading cause of blindness, and early detection makes a lot of difference. Next one is a mouth. So in the mouth, what are all the things we have to check means we have to check the pigmentation, and also mainly enlarged tongue you can able to see it in the hypothyroidism, and fruity or acetone breath it is there means which is indicating the diabetic ketoacidosis, which is a medical emergency. Next, neck and thyroid. So first we have to inspect the neck first. Any visible swelling at the front is a goiter, and you can able to see the buffalo hum at the back also. Now you have to ask the patient to take a small sip of water and swallow while you watch. The thyroid cartilage and cricoid cartilage should move upwards smoothly and symmetrically. If there is a asymmetric movements or a visible mass moving with a slow swallow, that is abnormal. And palpate from behind with your fingertips. Normal thyroid is smooth, firm and non-tender. A tender enlarged gland is a thyroiditis. And multiple nodes it is there means it suggests the metabolic process. A rapidly enlarging single nodule is concerning about the malignancy. So then you have to auscultate only if you found the enlargement. Place the stethoscope gently over the thyroid and listen for a bruit, which is a soft wheezing sound caused by increased blood flow through the thyroid arteries. Bruit which it will be present in hyperthyroidism. Next, in breast. Breast in females, galacturia, which is nipple discharge outside of breastfeeding, is caused by hypothyroidism or a prolactin secreting pituitary tumor. Breast hypertrophy can be seen in PCOS and estrogen secreting tumors. Atrophy is seen in hypopituitarism. In males also mainly have to see about the gynecomastia, which is present in thyrotoxicosis. Next we'll move into the abdomen. First in abdomen, look the striae first. That is silver white stretch marks are normal from pregnancy or weight gain. Purple or dark pinky striae on the abdomen and flanks are Cushing syndrome. That is a color differentiation. And also note the fat distribution. Central obesity with the fat concentrated in the trunk, face and back, while the arms and legs remain thin is the Cushing pattern. Auscultate bowel sounds. Decreased bowel sounds we can able to notify in hypothyroidism and increased in hyperthyroidism. Next, musculoskeletal system. Broad, thick fingers with the enlargement of the jaw and brow or acromegaly from excess growth hormone. Deep aching bone pain if it is there means which is a hyperparathyroidism. If patient is having generalized muscle weakness with wasting, it is a Cushing syndrome. And mixed edema is present means which is a hypothyroidism. Next one is a neurological. It is the last thing. So first find fast tremors of the outer stretched hand or hypothyroidism. And now for sensory testing, this is especially critical in diabetic patient. Test light touch with cotton wisp. Test pain sensation, sharp versus dull with a safety pin. Test temperature sensation with your hot and cold test tubes. Test vibratory sensation with a tuning fork placed on the bony prominence like the big toe and the medial malleus. And test position sense by moving the patient toe up or down with the eyes closed and asking them to identify the direction. Any loss of sensation in the feet and lower legs means patient is having a peripheral neuropathy, and you have to document this is immediately. And food assessment, it is mandatory for all diabetes patients. And heat intolerance seen in hyperthyroidism, cold intolerance seen in hypothyroidism. So this is about the physical examination of the endocrine assessment. So this is our endocrine assessment. Match each clinical sign to its condition and practice your thyroid examination with a technique. Always do your assessment on every diabetic patient every single time. Okay, thank you.